Of course, the most important highlight will be Corona, COVID-19, the pandemic. And since we all know that the laboratory plays a major role in testing strategies, we will focus on such topics. For example, Professor Georg Hoffmann from the University of Bonn will organize a session which, among other things, deals with the first major German outbreak in Heinsberg, or also on strategies for mass testing, since we expect a tremendous increase in the need for corona testing. Other topics in this area will be a session organized by Professor Stefan Holdenrieder from Munich, who will focus on immunology and strategies for vaccination. And a special thing is Dr. Peter Quick, who is head of the Life Science Research Group of the VDGH, the Association of German Manufacturers in IVD, will present very, very innovative tests. Of course, if there is any buzzword that came up during this year of the pandemic, it was certainly test. We all know that without a lot of testing, we can definitely not avoid the spreading of this disease. The real problem is not just detecting the virus and determining the virus load of the patient, but the bigger problem is probably which follows after the initial infection, and this is immunology, and especially the severe courses that need intensive care. And therefore, the diagnostic industry is especially focusing on biomarkers that help to detect those patients who will undergo such severe courses. And this is inflammation markers, for example, or coagulation markers, since we know that COVID-19 is especially thrombotic disease. And what I think is most interesting for the future is to detect genetic variants that would help to predict which patients have a predisposition for such severe courses. The actual pressure of the pandemic leads to an enormous acceleration of developments in our field of science. This means, for example, in the beginning when we started testing, it was mainly PCR. And it was already a big challenge to develop PCR tests for a completely novel virus that could be performed thousands of times a day. But meanwhile, we are at millions, and PCR is definitely too slow for that. And so industry is now developing so-called isothermal assays that do not need those cycles of the PCR and thus provide results much faster. Another development is rapid testing. Politics ask laboratory medicine to develop tests that no longer need sending a sample to a central laboratory, which usually takes hours. And so it would, of course, be of interest to have kind of a test strip assay, as we know it from pregnancy testing, for example, where you just get a color, a red or blue color, which says, oh, this is a super spreader. And these tests could then be used in schools or retirement homes, so that we would get test results much faster.